Next thing I want to talk about, patients ask me all the time, what's the ideal substance to put into my body? I hear so much about fat grafting. Does it really work? What is it? How do you do it? Fat grafting now is becoming extremely popular. For the first time, it's one of the top 10 cosmetic procedures being performed by plastic surgeons all over the country. And fat grafting is an important aspect in what I do as a cosmetic surgeon to restore different parts of your body that have been lost as a result of aging, or in the case of breasts, when women have mastectomies, using soft tissue to rebuild it. So fat grafting is a great procedure. Now, sometimes I will just do fat grafting to the face with no other procedure being performed. In fact, I did one on Friday where a lady has lost a lot of volume. And remember, as we age, we lose volume in our face, and it will vary from patient to patient. So the fat grafting procedure is we decide where we're going to take the fat. Most women will come in and say, well, I want to make my tummy smaller, I want my inner thighs to be smaller. So we decide on the donor site. We add some tumescent fluid, which is local and fluid, and we suction the fat. And then we take the fat and we decant it. We get rid of some of the serum. We wash it a little bit. And sometimes I'll put in PRP, platelet-rich plasma. And then we go ahead and put the fat into 1 cc, 3 cc syringes. Could even be 20. For example, if I'm doing fat grafting to a breast, I might put in 300-400 cc's of fat on one side. Well, I can't do it with a 3 cc syringe, so we put it in a 20 cc syringe, and then we can add the volume to the breast to rebuild it. Same thing when we do Brazilian buttock lifts, and I'm going to talk about that a little bit later. So we add the fat with much larger syringes and restore part of the body that is deficient in soft tissue. I would say probably 60-70% of the time when I do facelifts, I will add some fat to different parts of the body. Sometimes when people have a recessive chin where it's flat, I'll put fat all the way across the mandible to give them a more aesthetically pleasing jawline. So fat is a very versatile tissue. And at the end of the day, it's important to understand it's your tissue. Now, if there is a negative to fat, you have to understand that not all of the fat will take. 40 to 70% of the fat will take. And I think when we're talking about fat grafting to the face, it's probably more like 60 to 70% of the fat it's going to take. So fat grafting is great. And I'm utilizing it more and more in 2 prime areas, or 3 actually: the buttock, the face, and in the breast. So fat grafting is popular. I think you're going to see it grow in utilization and grow in popularity because, again, it's your tissue. It's not going to go away in a month or 6 months. But it's important to understand that when you do a procedure, whether it's fat grafting, facelifting, we're not stopping the aging process. You're still going to age, unfortunately. Bad for you, good for me. So fat grafting, I think, is becoming more and more popular. It's a great procedure, something to think about in the future.